My name is Alan Manning and I'm the Executive Vice President at Planetree. What makes me passionate about healthcare actually is my daughter. I joined Planetree 7 years ago now because I wanted to help change healthcare. I thought that the system was broken, and I went on a national search looking for an organization that I thought could really make a difference, and I found this great place called Planetree because 10 years ago, this past May, my firstborn daughter was born, and at 2 days old she had her, I got a call from my wife saying there's something wrong with Katie's heart, and at 4 days old Katie had her first open heart surgery, and over the next 6 months Katie had 5 open heart surgeries and 4 heart catheterizations before unfortunately she passed away when she was 6 months old. So actually next month is a 10-year anniversary of my daughter's passing. So it was actually really moving for me yesterday to be here and meet our founder of Planetree on the same day that this time 10 years ago I was sitting at my daughter's bedside in the last month that I'd ever meet her. So my passion and my drive is my daughter. She's my inspiration for what I do. But more than that, it's the people I met during her care. I met some amazing people who provide incredible care to patients, but I found a system that wasn't supporting them particularly well, and I wanted to get involved and help and make a difference. You know, I tell people all the time, I'd be lying if I said, you know, it was a greater purpose. I miss her. I wish it never happened. I wish I never got involved in healthcare. I wish I didn't have to know what I know. But we all get paths, every one of us. So my story is my story. You have a story. Everybody out there has a story, and we just have to go on the journey we're on. And I'm fortunate today I have 2 wonderful boys who are 8 and 6 and remind me of their sister every day. And my wife and I started a non-profit in her honor, and we help critically ill kids in pediatric ICUs. And the story I always tell people is when my daughter was born, I thought that she'd change the world, right? Like my heroes, Nelson Mandela and Martin Luther King and Mary Robinson, the first female president of Ireland. And when she got sick and when she passed away, I didn't know that would happen. But a couple of years ago, I got word of a girl back in Ireland where I'm from who was 7 years old and wasn't able to walk, and her name was Katie, just like my daughter. And my organization was able to sponsor her to come over to the United States to get a spinal surgery that allowed her to walk for the first time. So when I said that my daughter was going to change the world, I was right in some small ways, so she did have an impact on somebody else's life. So her legacy lives on. The organization is called Kisses from Katie Inc., and we help children, families and caregivers of kids in pediatric ICUs, because although our outcome with our daughter wasn't what we wanted, we were actually very lucky because we had the financial resources, we had the education, we looked and sounded like the doctors, so we got along with them, and we saw many people who didn't have the same access. So we started an organization to help those people, and today we do simple things. Our motto is to take the edge off, and we do simple things like we pay mortgages for families who are getting ready to lose their house or pay their rent, or provide them with, we've bought washing machines for families, we've bought assists to help children get in cars. So very functional, practical things, but things that really get in the way of people being able to live their life and live their truth in the way that they want. Our experience at Planetree, we see that, I mean, every patient struggles with the healthcare system. The most affluent, the least empowered. Obviously it gets harder the lesser education, the lower wealth. You know, we talk all the time about consumerism in healthcare, and quite honestly it's one of my biggest frustrations, because I think consumerism is an entitled approach for the 1%. Because I know many people who, consumerism for them is wherever the bus stops or wherever the subway stops. They're going to go where the insurance is covered. So we talk about these choices that patients have, but in truth our healthcare system doesn't provide people with many choices. And in fact, when I think about what my work with Kisses from Katie, I'll never forget watching them do open heart surgery on my daughter in her room because I couldn't stabilize her to bring her downstairs. And when the medical team came out, they were talking to us. The girl in the next room coded, so I ran in there, and the mother came out and she was crying, and my wife and I went over to console her. And I looked at her and said, I think your daughter has the same thing my daughter has, because everybody in an ICU knows each other's business. And I said, does your daughter have HLHS too? And she said, no, my daughter has hypoplastic left heart syndrome, HLHS. Her daughter was 6 to 9 months old, and this poor mother didn't know that hypoplastic left heart syndrome was HLHS, which means she could never have read any of the material. I mean, she never understood anything the doctors were saying, because they don't call it hypoplastic left heart syndrome, they call it HLHS. And I looked at her and I just politely said, oh, I think it's the same thing. And my heart went out to that mother that night, because she was about a 16 or 17-year-old single mom. And the night beforehand I heard her dad yelling at her through the wall, if you hadn't put yourself in a situation, none of this would have happened. So what chance does this mother, does this child have for success? And we don't have a system in America that helps families navigate and traverse that to find success. So I think we spend too much time on sickness and medicine and not enough on understanding that this is just a part of people's life journey. My goal for healthcare is equality, quality, and respect. I would simply say it like that. I want equality that everybody gets access to appropriate care. I want to make sure that the care they get is top quality care. I want to make sure that they're dignified and respected through their process. So if you want to find information about me, you can find it at www.planetree.org. You can find me on Twitter at PlanetreeAllen. If you want to find information about Kisses from Katie, it's kissesfromkatie.org. That's about it.